Hi, Kevin Henry, the Group Editorial Director for Dental Products Report and Modern Hygienist, and I'm on a Google Hangout today with America's Dental Hygienist and my friend Anastasia Turchetta. Good morning, Anastasia. How are you?
I'm doing great, Kevin. How about you?
All great. I appreciate it, and thanks for taking a few minutes to talk to me today about smoking cessation. You know, you and I have done some hangouts on e-cigarettes, and I know you've done a lot of research about the whole cessation and tobacco usage and everything else. We had a report on Dental Products Report's website the other day that said that only 10% of smokers get smoking cessation advice from their dental professional. And I know that that kind of surprised you just as much as it did me whenever you saw it, right?
Oh, it absolutely did. I thought there's no way this is right. So of course, I'm going to be like everybody else. I'm going to click on the research and look at it. And the one thing that impressed me was they include dental hygienists in on the study. But it also at the same time surprised me because I'm like, that's still only 10% of the people polled. Now, out of that, just to be clear for everybody listening, that includes all medical, like your physicians, your dentists, your dental hygienists. So this is a huge study that was put out there, and they just asked, have you had somebody help discuss or start to discuss the reason to quit smoking?
I know one thing that you and I have talked a lot about in the past is obviously the role of the hygienist and the role of education by the hygienist. And one thing that we always come back to is there's not enough time in the appointment schedule to do all of this. So if the hygienist is truly going to make that impression on the patient about smoking, how's a good way for him or her to do that during such a crunch time?
Yeah, that's a great question, and I believe it goes, and it starts again with your health history. So you're going to have to look and see, when did they quit smoking? Did they ever smoke? And you can kind of tell too, because we all know and we've all seen the effects of smoking on, periodontal tissues and the palate, usually with stain also. But I think it really starts again in asking more questions, and then of course while we're doing our hand instrumentation or ultrasonic instrumentation, it's a good time too to discuss, hey, have you considered quitting smoking? And there are some options out there for you, and it's providing them with information so they can go get more information. I agree that there's going to be a lack of time, because a few years ago I attended a CE and it was like we were supposed to do this mock intervention. Oh, Kevin, really? I don't see dentists and dental hygienists showing up at the door of our patients going, we're going to have an intervention. Are you ready to quit smoking today? Rah, rah. It's not going to happen. But I do believe we're responsible to say, hey, you know what? Gum disease is related to smoking, and smoking also affects every organ in your body. It affects various cancers, including oral cancer. And believe it or not, some of them believe it's also a risk for cognitive impairment.
So we can't have an intervention. We can't knock on their doors. You know, there's a lot of things that we can't do. And honestly, I know this study, and forgive me, I don't have the number right in front of me, but a surprisingly high number of smokers said that they were actually ready to quit, which I thought was very interesting. So how do you see a dental professional being able to take a step and really help that patient get to that point?
I see the dental professional actually, there's a few things. Number one, it would be to revisit that, because sometimes I know too, we're put off by saying, I've mentioned this before, they're not going to do it. I might as well just forget about it, right? But we never know truly what that person is going through at that time in their life. So I feel we as healthcare professionals should never give up. So at least introduce that conversation again. So one, it's taking that quick moment to reintroduce the conversation and give them options. Like, have you ever heard of Chantix? Would you like to try that? I do understand that e-cigs, without the nicotine or researching that, that's an option to get people to quit smoking. Finally, what about training your team and getting more educated with your team on understanding the process of smoking cessation to get them more involved? I realize we may not get reimbursement, but you know what, Kevin? The real key factor here is to look at it as an extra entity in the entire practice. If we're going to discuss sleep medicine, no one discussed that before. Are you sleeping through the night with sleep apnea? So really it's just taking this and becoming more knowledgeable, and the training is there.
And when you and I were off camera chatting before we started this, you had a great idea about how the dental practice could use their website and social media to kind of push the message as well. And I was just wondering if you might share that with our viewers.
Absolutely. There's three ways. We all know that video is strong. So I encourage you, I mean, video blogging about it, I think is very important, and placing that on your, your Facebook page. I feel that if you could write some facts, or even check out this, which was on Medical News Today. So maybe we can provide the link for them. Take a couple of statistics from that and place that on your Facebook page. Like, did you know that, have you asked us? We can help you. Something like that. And then also including something in your newsletter. So there's three ways that you can hit different people who may like a different style of information.
It's good stuff. Anything else you'd want to throw out there for the dental professional who's wondering about how to talk about smoking cessation in the practice?
I think it's just really remaining consistent in your message and to not give up. Just because you mentioned it before and they didn't do it, that does not mean that they're never going to do it. Some people maybe, but you just never know when you might hit that one person, and you can help them become more healthier, and that's what we gave our oath to when we got into this profession.
As always, Anastasia, I appreciate your expertise and your time. Thanks so much, and have a great rest of the day.
Thanks, Kevin.